everybody. Hope you're having a good afternoon. Like I said, I'm Jonna, and I'm going to talk about today. What we're going to talk about is the interim and final rule with comment, and we're going to hit some of the highlights for that. We're going to leave plenty of time for questions at the end. And I know Sarah will also come off and provide any information that she wants to cover too. That's our goal for today. So, like I said, our agenda is really going to talk about just this interim final rule with comment and the key takeaways. Those of you, I'm sure you know, on at the end of the day on June 1st, CMS released the interim final rule with comment period. So, if you aren't aware, they are accepting public comments through or all comments, not just public, but all comments through July 31st. And so the rule has the information in there. If you want to provide comment, there's different ways you can provide comments about what's in there. But today we're going to hit a couple of key topics, and then we'll talk about the next webinar. So what it is. So like I mentioned, it is the what I call the guidelines, the guardrails, the marching orders, whatever you want to use to information to states on how to implement the community engagement requirements. And so one important thing is that most of this information is not new. It is just providing those specifics, the details to the states about the different parts that were in HR 1 from last summer. So some of the things that it covers, it talks about who's an applicable individual, and that's the group who must show community engagement as a condition of their eligibility. It clarifies some of the qualifying activity details. Those four qualifying activity groups: work, education, worker training programs, or community service. It details specifically excluded groups, and that's the group of individuals or someone who fits into that category does not need to show community engagement. So they do not need to show any kind of activity on those four categories. It talks about who meets mandatory exceptions, and it has a whole section on how the states must verify all of the different pieces. It also has an entire section on required outreach and what must be included in the outreach and how often the outreach must take place. Again, not a lot of new information. It did provide some details about what they meant by periodic, which is what HR 1 said before. There was some orders about reaching out 3 months in advance, but then it said HR 1 uses the term periodically after. And so the interim final rule did attempt to define what periodically after means. It also talks more about steps for noncompliance, how the states can engage MCOs, and goes over the state's reporting requirements in some level of detail. Still some things unknown, but this does give some more information for what states are going to have to collect and report back to CMS. Like I said, overall, this is really just it is a guideline. It did not change a whole lot of what was in HR 1. It just provides that level of detail. Next slide. So a few of the key takeaways that we've identified, like I said, I'm not going to go into detail about the first box here, but it does have clear details and definitions. It includes definitions for many of the terms that were in HR 1. For example, what an applicable individual is, what a caretaker relative is, what it means to have SUD, what it means to be a family caregiver. It provides guidelines for community service, so what counts and what does not count, and what is needed to prove that activity. So we have some information more than what HR 1 said about that qualifying activity. It does narrow the medically frail exclusion. It talks about how the condition must significantly impair the person's ability to participate in any of the four qualifying activities. So it's no longer just a condition, it is they also must significantly impair something around working, education, training, or community service. We'll talk a little bit more about that in a couple of slides. We'll also talk about community service in a couple of slides. The short-term hardship exceptions, if you recall, there are four of those that were in HR 1, and those were optional for states to consider. And what the interim final rule talks about is that if a state is going to offer these, then they must offer all four. It talks quite a bit about self-attestation in the different parts, whether it's an exclusion or qualifying activity or an exception, and really looks at phasing out whether or not someone can just sign their documentation with a penalty of perjury in 2027. That is going to still be allowed, but in 2028, there are some restrictions around that and beyond. And then it also goes over some details about when the federal government has determined or decided not to make a definition or not to provide specifics, and when the states can make those kinds of determinations or those components make those decisions for themselves. Next slide. So who's affected and who's not affected? Next slide. So this is the list of specified excluded individuals. These are the individuals or members who are not subject to requirements. There are no changes to these groups from HR 1, other than the definitions and specifications that we've talked about. So none of these really changed. None of the language changed with how it's written or how the small bullets that you see there. What it does outline, and this was what the state was already doing, which is that states must determine these types of situations for these conditions or these bullets here that you see on the screen before they can determine compliance. Before they can look at any of the compliance with qualifying activities, they have to determine that someone is not in any of these groups. And then after that, that's when the state must look at the qualifying activities. So again, none of these changed. I do want to call out a couple that I've seen and just different things that get a little confused. The SNAP and the TANF piece. It's pretty clear in the IFC now that it is a member of a SNAP household who must meet SNAP work requirements. Those people are specified excluded individuals. They do not need to comply if they're a member of a household who has to meet SNAP work requirements. Whereas TANF, they have to be meeting the TANF work requirements to be excluded. So a little bit of a nuance and a little bit of a difference between those two that I've seen some confusion around just in other publications and things that are have been posted. Next slide, please. So the applicable individuals, those are the people that have to comply with one of the four qualifying activities. There are no major changes to those. It's the members of the Medicaid Adult Expansion Group that have to abide by those new rules. And then there are the mandatory exceptions for those applicable individuals. And those conditions or those definitions didn't change either. That's people under 19, if they're entitled to enrolled in one of the Medicare programs, if they're part of the mandatory groups for Medicaid, infants, children, low income, some certain low-income adults, blind and disabled, some of those individuals, or if they were incarcerated at some point within the last 3 months prior to the month that they're being reviewed, they are an exception for that month. So they're not an excluded individual forever, or for the period of time that the rule tells the state that they are excluded, but they are accepted for that period of time, for that month of their review, if they were incarcerated in 3 months prior to that. A little bit of a nuance there too. Thanks, Laura. Next slide. Now we're going to talk about the qualifying activities. So what we've highlighted here for you guys is some of the content of the interim final rule and what changed. So we'll talk about work in a little bit more detail in a minute, but overall, what did change, which this is a good thing. We believe that a lot of the clarifications that were made by the interim final rule are going to be good. They're more broad. I think they allow people um, different opportunities to qualify than what we originally thought. And one great example is work. Now it does allow in-kind or unpaid work, paid or unpaid on-the-job training, to count for those 80 hours of work or combination of whatever the qualifying activities are for the person. But it does allow in-kind and unpaid. Another part that we have a slide about here in just a few minutes is the family caregiver exclusion category. Um, if a person is a family caregiver and meets the definitions of the family caregiver exclusion, but they do not meet or they do not meet the criteria, I'm sorry, then they can count those hours that they spent providing care as work hours. So it can count towards this work part of the qualifying activity. Education, at least half time. The interim final rule talks about that the education entity, so if that's a college, a community college, whatever that is who determines whether or not someone is full-time, part-time, or less or half-time. They did not make any definitions for that. They allow the institution to provide that or to make that classification for the person. It also added on high school enrollment for individuals who might be 19 and still in high school. So that still counts as part of their hours. And it also added high school equivalency programs, GED programs. It has some specifications around what those programs must look like, but it does allow that to count towards the education hours. It mentions specifically those skill type programs like welding, cosmetology, that those hours that it takes to learn those skills and those kinds of programs, all of those hours are going to count. The hours in the class, the hours it takes studying after, it provides those guidelines that all of those hours count towards this education piece. It gives states a credit hour conversion to calculate the number of hours for people who might be participating in any of these things, halftime or halftime or less. And it also says that for your college students, community college students, et cetera, that when they're on their education break, spring break, Christmas break, whatever, that they still remain qualified. They're not going to require individuals when they go on break to have to meet some other standard or go and work or whatever. If they're a full-time student, then they still qualify. That still qualifies as education. The work programs. It now includes supervised job searches as long as it's less than half of the time, less than half the number of hours, so less than half of the 40 hours, if this is all that the person is doing. That does count towards meeting the 80-hour requirement. It clarifies that unemployment insurance and the job searching that's done through a state level program, that also counts. Next slide, Laura. Or whoever, I'm sorry, Laura, you're the one driving, right? Community service. So this is a big part of what the interim final rule provided us with guidelines about. It specifies that it is unpaid work. You can see there, we tried to bold kind of the keywords from the rule, that it must be a structured program. So it can't be, something that is not structured, if you will. It has to have a direct benefit to the community. So it cannot be a direct benefit to one person or, you know, one to themselves but it has to be a direct benefit to the community. And we have another slide on this. I'll go into a few more details here in just a few seconds. It requires a process to track the type of activity, the dates and the hours of the community service that was provided, and a point of contact where the person is volunteering to confirm the hours. And then the last two you see on the slide Again, not a lot changed with this. A combination of any of the above four activities up to 80 hours counts. And it gives states some information on how they must combine hours, and that once someone reaches the 80 hours, the state stops. So if they're working 80 hours and they meet 80 hours, then the verification stops at that point in time. The state does not have to look at education or community service or anything else that the person might be doing once they meet 80 hours. Qualifying income clarifications. It talks a little bit about, or not a little bit, but quite a bit about that the federal minimum wage is what is used, or what is the only one that can be used. It can't be a state minimum wage. It can't be other minimum wages that might be out there. It has to be currently the 7.25 an hour that is used, and those are used in situations when a person's hours worked cannot be found, whether or not that's data that doesn't exist, or there's an issue with being able to get the data. Then the state can use that income, and that's where the 580 that you've seen before also comes into play, because if you multiply the 725 by the number of hours, then it does equal the 580 rule, the income of at least $580 a month. It talks about how quarterly wage data is used or can be used, and what the states need to do if quarterly wage data is all that's available, and also how those seasonal workers who may work and how that works, if they work in the either holidays or in the summer. So it does talk about all seasonal workers, not just the summer that you think of, but it also talks about like people who work during the holiday season. So a little bit more about work and a couple of examples. It can be in exchange for money, for goods or services, in kind work, or unpaid work other than community service. So these are the two ads from the interim final rule, and you can see the example that they give, which an individual who performs duties like they're a property manager, they're a building manager, and they receive reduced rent or free rent by being the building super, then that counts as work. They will have to, obviously they need their hours. They need to prove that it's 80 hours a month, but that counts. Unpaid work, which is different than community service, that it can benefit an individual or some private entity and not necessarily the community. And it's, not being paid, then that can count as work as well. The example that was given is maybe an unpaid internship, or some other type of unpaid situation that a person works. Again, if they work their 80 hours, that counts, meets the qualifications. If it's 80, or if it's less than, combination of all the other four activities up to 80, that would count. A little bit more on the community service definition. It is not limited to only 501c3 organizations like we originally thought it was going to be. So this is any public or nonprofit. It does not have to be a 501c3 organization. Some other limits that it says is that the volunteer work cannot be for partisan activities. So it specifically talks about volunteering for elections or candidates. That cannot count towards community service, because it cannot be a partisan type of community service hour. It cannot be purely recreational. So, somebody that's doing community service that might be recreational. I'm trying to think of an example there, and I can't come up with one, but and it cannot benefit specific individuals. It also includes and has an example of activities that might allow a person to develop skills that are necessary to complete a community service activity. And an example that they give is maybe it's someone who's volunteering to teach computer skills to individuals. I think that can be a good example. Someone that maybe needs to learn basic computer skill language to teach something to a senior center or something like that. Then the time the person spends learning those skills for that community service activity of teaching those seniors can count towards qualifying activity. And then again, the activity must be done under the supervision of what that public or nonprofit organization, whoever they are, that is benefiting the community, and the organization must provide oversight of the activity, have a process to track the type of activity, the date, and the hours that the person is doing community service, and have a point of contact that can confirm the person actually did do the community service. So some things that we're doing now in relation to the community, the qualifying activities or the state is doing, there are um, collaborations with the Department of Commerce and Workforce West Virginia for the workforce training programs and all of the parts around that. So they're meeting BMS and everyone involved has been meeting with those entities to work out processes and systems for that and to obtain the information and the data and make sure that the interim final rule details are incorporated into that. As I think they mentioned last month, I was on vacation last month. I missed your meeting last month, but I think we talked a little bit about West Virginia 211 and a referral network to help make sure that individuals have access to qualifying activities. And the 211 will also probably be a good point of contact for those community service opportunities as well with those organizations. And then we're also doing extensive eligibility staff training and starting those modules as we speak with all of these IFC or IFR, I'm sorry, interim final rule um, specifics and details. Talking about clarifying exclusions. So wanted to give one example because we know that this has come up several times and bubbled up as something that people have talked about, which is the caregiving exclusion. So if you think back to that previous slide, the specified excluded individuals, people who are a parent, a guardian, a caregiver relative, or a family caregiver who are providing care to children who are 13 years of age or under or a disabled person of any age. So that's a point that the IFC or the IFR, sorry, haven't used the wrong acronym here. The IFR really talks about that the caregiving for the disabled individual is for people of any age, not just the 13. So make sure everybody kind of is on the same page with that. But specifically, the family caregiver, we've put the family caregiver definition here as an example because the IFR does define all of those terms. It tells us what it means to be a parent. It tells us what they think it means to be a guardian, what they call a caregiver relative, and what a family caregiver is. What it says about a family caregiver is that it's a adult family member or someone else who has a significant relationship and who provides care within a broad range of assistance to a dependent child age 13 or under or a disabled individual of any age. So it does specify that those disabled individual, what they mean by that is that it meets a specified ADA definition. It does not have to be a person who Medicaid has declared as disabled. It is actually based on the ADA definition. It also refers to the care within a broad range of assistance and specifically mentions that they've left it that broad so that states cannot require a certain type of assistance or multiple types of assistance for someone to be excluded. So it is listed as you see on the screen broadly of care with a broad range of assistance that the exclusion for this whole excluded group, not just family caregiver, but the whole excluded group of parent, guardian, caregiver relative, or family caregiver can apply to multiple members in a residence as long as they meet one of the definitions that are listed in the rule. A parent, a guardian, those four groups, and those are all defined that the caregiving hours, and I've talked about this a little bit, the caregiving hours counts towards unpaid work if the caregiver does not fully meet the exclusion definition. So if there's someone that is in those four groups, but they don't exactly meet the definition of a guardian or of a caregiver relative or a family caregiver, then the hours that they spent providing care to the child or the disabled individual can count towards their unpaid work, their 80 hours that they have to meet that way. So, medical frailty. This is another one where um, has had some change in what the state was originally thinking. It modifies in terms of medical frailty. It adds the part you see in bold, that the condition must significantly impair the member's ability to satisfy the 80-hour per month requirement. So whatever the condition is to meet the medical frailty exclusion has to impact significantly their ability to work, to participate in an education program, participate in community service hours, or some sort of work training program. So it's narrowing that exclusion by tying that medical frailty to functional limitations rather than just having the condition alone. However, we know, and CMS has said, that there may be some conditions that are severe enough just by having the condition to qualify for this medical frailty. An example might be someone who has had an injury and is, a quadriplegic, for example. That may, in and of itself, um, be enough without meeting this significant impairment part of the assessment, if that's documented. Next slide, please. So a couple of other things related to the medical frailty challenges that's going to be challenging for implementation, is that it does require states to use reliable data from the preceding 12 months first. So the state will have to look back 12 months for the member or the applicant, to look at these medical frailty exclusions. The states are going to be able to combine diagnostic codes, utilization data, medication data, or any other factor as available to do that. So it's not going to rely necessarily just on one source. They have to verify the presence of the condition and the severity, like I said on the previous slide. One really important thing I think in the next bullet is that the lack of available claims or encounter data cannot be used as the sole reason to deny the medical frailty exclusion. So the fact that there's no claims data over the last 12 months does not allow a state to deny just on that. They have to have other information. Sarah, I see you're coming off. Do you want to say something there? Oh no, maybe my screen just changed. Sorry. Um, it may require some provider attestation when the claims data falls short. If we don't have the information, if it's a new applicant especially, and they don't have information in the utilization data, then it could require provider information. The states also must develop a process for a person to request consideration for medical frailty. This allows for changing conditions. It allows for conditions that might not have, again, they might not have, the state may not have the diagnostic code or the utilization data in their system to be able to verify. So there has to be another step for the person to request consideration for this group of exclusions and exclude them. So what West Virginia, some of the things that we're doing, we're exploring options for medical screening tools like questionnaires to help identify that severity and complexity of the condition, that how it might significantly impair someone's ability to work, go to school, go to a training program, volunteer in their community. They also are completing or will be creating that process for members to request that consideration as well. Short-term hardships. So these are referred to as events. So if you think of these, think of this as an event that happens in a person's life. It only exempts someone for the month that it's being looked at. So this is not a forever thing, although some of these exemptions may last for a while. This is not a situation, and what CMS tells us is it's not a situation where you can accept someone forever. That has to have a time limit to it. So it's looked at as an event, if you will. So like I mentioned earlier, the states have the option to adopt these. And it's whether or not these situations or these events occur in all or part of the month where the information is being looked at. So if you look back, if you think back to our previous conversations, the state has decided to look back 1 month to see what, whether or not someone was meeting the qualifying activities. This is where that is the month in which all or part of that month, if one of these situations or events will it have happened, then that's where this exception comes into play. It clarifies that states must offer all four of them if they elect to offer any of them. And West Virginia is still determining whether or not they will use the short-term hardship option. So there hasn't been a decision made, yes or no, whether or not these are going to be part of the program at this point in time. All four will require some sort of request process. Some of those, and we'll get into those on the next slide, but some of them is a request process from the person, from the member, or someone who can act on their behalf, or the state itself may have to do a request of CMS. And then the IFR gives definitions of all of them, and then it provides a lot of operational methods that they can use to determine the short-term hardship, and it mentions several components that states get to determine for themselves. Next slide. So these are the four short-term hardships. One is that a person has to travel for care outside of their community for a serious or complex medical condition for their self or their dependent for an extended period of time. And so West Virginia is this is one of those examples that where CMS left it up to states to determine what outside of their community means and what extended period of time means. So if West Virginia decides to elect all of these short-term hardships, that'll be something the state will be working on. This is one of the hardship exception events where the individual or someone acting on their behalf must request this exception. So again, if West Virginia makes the decision to offer this or to have this as part of the community engagement program, then there will be a process created for the individual or the person to make that request. The next one is inpatient care. So think of that as hospitalizations. It also includes outpatient care and this is the direct wording from CMS, of a similar acuity. The IFR does give the state, like I mentioned on the previous slide, it gives them a lot of operational methods to determine that similar acuity and gives a lot of examples and ways in which a state can operationalize that part. So that is there for the state when and if when the state decides if they're going to offer this one. They also note that these services may overlap with the medical frailty exclusion. So it might be a situation where the person has, this short-term hardship event, but they also might have a condition that is going to exclude them and make them a specified excluded individual, so they do not have to comply because of that reason, not necessarily for this month because of the inpatient hospitalization or the outpatient care. This is another one that the individual or someone acting on their behalf must request. Again, there'll be a process for that if West Virginia decides to implement that part. If they live in a federally declared disaster area or emergency declaration area, this is more of what we call an automatic exception because once the declaration has been made for that area, then people who are in that area apply, it applies to them. This is one where the state has to inform CMS if they plan to apply this hardship once those federal declarations have been made. And then the last of the four is living in a county where the unemployment rate is at or above the lesser of 8% or 1.5 times the national unemployment rate. The IFR gives the state, again, operational guidelines for how to determine what that is, what rates to use, how if the state chooses to do that. And this is one where the state must seek CMS approval to offer this exception. So as I said, West Virginia is still determining whether or not that they're going to implement these exceptions. Self-attestation and verification. So the IFR limits self-attestation, as I said on the first slide of the kind of top points. It limits Self-attestation to situations when that data matching, that ex parte data matching, is not successful for either an exclusion, an exemption, or a qualifying activity. So in 2027, as we said, people are going to be able to just sign a form that that says it is a legal form. You know, can perjury is part of that, but sign a form that say I have this, I did this, whatever that is. But starting in 2028, they can only do that once in their continuous enrollment period, and then after that, at their next renewal time period, then supporting documentation will have to be provided. The state will not be able to accept that person's signature and their testifying that they have whatever the condition or the situation is. And that also counts for qualifying activities. So keep that in mind. That means if they're community engaged or community service, education, and it can't be data matched. If they're self-employed, for example, or whatever, they'll have to be some sort of certification or some sort of record to accompany that at the renewal period. Next slide. So just a reminder, as I said, West Virginia is using that 1 month look back time frame for qualifying activity verification. So for work, education, um, work training programs, or community service. And then, like I've already reviewed, the 2027, they can accept the self-attestation. After that, it'll only be allowed once in a year. After that, there'll have to be documentation if it's available. And it does give a little bit of out, as you see here, the documentation will be required if it's reasonably available. So CMS does give wiggle room in a couple of places like that. So there may be situations where maybe it's not as black and white as it looks on the dates. Ongoing and next steps for us. So we're incorporating all of these updates and all of these definitions into our partner-facing materials, our public-facing communications, our website, etc. We are preparing our targeted outreach for July through September, and that's going to include wider marketing tactics. We're updating partner toolkits and expected to be disseminated at the end of July. And then our August activity is going to center around that staff training for all of the county workers, the people who answer the phone calls, the phone, et cetera, that work for DOHS and the county offices.
Thank you, Jonna, so much for that presentation. Yeah, lots of information to absorb, and we will share those slides out for folks in case you have follow-up questions. I'm sure you will. So I'm just gonna go through the chat and ask a couple of the questions that have been dropped here, but folks are welcome to come off mute. However you want to ask your question, please do. So the first question is from Sally. She asked if would an arts thing be recreational? Or yeah, would that be recreational if a musician or artist is teaching someone or is a coach for a sport, for example? Like how might that fall into this?
I don't think we know how they're defining recreational, as Jonna said. It'd help if we'd go to that, maybe to that slide. I think it would have to go through that criteria. Like, does it benefit just one person? Is it something that's available to the public? Is it considered unpaid work? I think there's a lot of questions. It's unfortunately not an easy answer.
Yeah, and Sarah, I'll just add the recreational point was on the community service hours, so it wasn't on the unpaid work. It wasn't on the unpaid work section of the IFR. So if someone, especially if they're an artist and they give private lessons and they accept money for that, then I think that probably falls into that work category more so than the community service where it's recreational category. But again, like Sarah said, we'd have to take a look at that. But in the example that you gave, to me, that might fall into more of the work, unpaid or in-kind work, versus the recreational limitation for community service hours.
I was just kind of envisioning if someone in the community wanted to teach like a group of young people music, choral, stuff, or have a little band or a community band for young people, or an artist teaching children how to do something, throw pots, or make something artistic or do a mural, does that fall under community service? Working not only for themselves, but a community service, but would be participating in, say, a mural. We do lots of murals, that kind of thing, in the community. Or do they consider the arts recreational? More in that context. And the coach was like in terms of you know coaching young people and learning how to play any kind of ball, basketball, baseball, soccer, that kind of stuff, or teaching children how to swim, that kind of thing, or play tennis or whatever,
Yeah.
or
And
working as a lifeguard.
yeah, well,
Without,
working as a lifeguard, most lifeguards get paid, right? So, so,
yeah,
so that would
most
fall
of
into the work. That would fall into the work. A lot of coaches get stipends or paid, so that might fall
Mhm.
under the work and not the community service. But as Sarah mentioned, there's going to be a lot of nuances between the unpaid work and the community service and how that gets operationalized in the data matching system and all of the other processes that the state has to do. But those are some good points. Thanks for bringing up those examples. Um, Rhonda, I'm going to grab one. I think this was from Sally too. Medical frailty include mental health conditions. One of the medical frailty categories is someone with a disabling mental health condition. We don't have those. I don't think we had those on these slides today, but there are 9 components of medical frailty, and mental health conditions is one of the 9.
Thank you. And I had another one on the way, but I'll just ask it. Will you be hiring more personnel to deal with all the data you have to gather? Seems like a lot of extra stuff on your shoulders.
The county offices are managed by a sister agency. I can't really speak to their hiring practices. We are engaging a number of vendors in order to try to lessen that work so that we can hit all the data sources and get all of this electronically that we can. So trying to mitigate that burden.
Does anyone else have any questions?
This is Benita. I'm sorry I don't have a little hand on my computer. I have a couple of quick questions. One is, when is the state plan due to CMS? I'm presuming there's going to be a state plan that CMS has to approve for all this. Is that correct, Sarah?
So not like what you're used to seeing. So not like a state plan amendment. We have a MVP, a minimal viable product. I don't know. I can't think of what that stands for now. A checklist that we provide to CMS on a regular basis to show that our progress in all the areas that they're considering us to be minimally compliant in the first year. So that's what we've provided to CMS, and it gets into those technical pieces, but it's not really going to be like a state plan like what you're used to seeing.
So have we submitted one already, or does it get submitted after these regs are final?
The checklist we've submitted since, I don't know, maybe since January. We've provided updates. A lot of that has been to be determined as we're working through the various system pieces. Their focus right now really is like the system pieces. We'll have updates to our verification plan that we submit to CMS every year as well, showing like what we'll accept for verification of certain items. It's maybe not quite as concise a plan as what you might expect.
Are those documents on the BMS website under CMS?
They're not. It may be on the CMS page. I'm not sure if they've made those, if they're publicly available.
Okay, and this may sound like a very dumb question. Who exactly is in the adult category? I read the definition. in HR1 and the reg. And how do we designate them within our
Yeah.
Medicaid program?
That's not dumb at all. And that's what we're struggling with is, years ago we took out, the various codes. There's like 40 ways to qualify for Medicaid, right? So we quit identifying people in like, what group they were in. So we just say Medicaid or CHIP. But it is that expansion population. So when we expanded Medicaid in 2014, it's that adult expansion group. So they are 19 to 64. They don't have Medicare. They don't have a lot of these, exemptions. It's just that ACA expansion group, if that helps. But unfortunately, we'd moved away from saying you qualify under expansion. So we're working on ways to better help people identify that this applies to them versus others who might these individuals qualify based on their age and their income and very limited factors. It's not those that are eligible based on receipt of social SSI or disability or other older groups.
So how do we know exactly who is covered and who isn't covered?
So in our system, they're all coded under one code. So it's MGAD, which means nothing except for us. But we know exactly who they are. And like I said, that's what we're working on, making sure that it's identified in a meaningful way to individuals so they know that it applies to them. But we do have a definite count as to everyone that is in that category that is subject to this new requirement.
And one last question, and thank you for letting me ask several. The time frame to get a document from a medical provider, if that's needed for the medical frailty, is there, has the agency determined what that time frame will be once the first part isn't conclusive and they need to get a document? What might the time frame be? And secondly, has the agency looked at the time frame it takes people to get appointments with medical providers to get documentation?
Yeah, and I saw Jeremy had a similar question. So that is not our intent at all. So for our current members, our intent is to first look at all the information that we have, all the information we have in claims, all the information that the MCOs have on their members, because 99% of them are in managed care, is to start there. And I think our very last ditch effort would be to, have them get some sort of documentation from their provider. So as John has said, we'll be adding in, like, if we can't just use the diagnosis or a claim information alone, we'll be looking at the member attesting that, at least definitely in this first year, that this condition means that they have difficulties with these activities. So that would be now for new applicants, that's a little trickier. And that may require, something a little extra or, maybe a more reliance on best information that we have at the time for that first, that first renewal period or that first certification period. But we're hoping to not go the route of requiring a lot of extra medical documentation.
Thank you very much.
The next question Foster asked is, what is the estimate of folks who will just not go through with the paperwork with the new criteria, or the number of West Virginians who will be added to the list of uninsured?
Yeah, and that's a fine line, is to not create panic, is to, present this in a way that is the most welcoming to people to go through the effort, right? So we are starting with our usual ex parte renewal process. So if we can verify electronically that they have income that makes them compliant, if we can use information that we already have in the system to determine that they are exempt, or we have, there's something else that would make them compliant with this, that's what we're gonna go with first. So again, we're hoping to lessen the number of folks that have to do something extra, and that, to your point, will be frustrated by it. We're also, leaning on you all to help us with that education and how to get that message out in a meaningful way, that it's community engagement. I think the thought of like work requirements might be scary for a lot of people who really can't or have not done this for a number of years, and are just going to throw up their hands and not do it. So it's a really fine line, but we're doing our best to mitigate that panic and that fear. And I think a lot of the changes in this interim rule have been maybe a little more generous than some of the definitions we were looking at. So we're hoping that helps as well.
Does anyone else have any other questions? Um, Jeremy asked if there are any updates to Path to help make the application process easier for clients.
I don't know if it'll make the whole process easier because we'll need more information. But the intent is to get as much electronically as possible, or for those who, aren't going to go the electronic route, to get as much through the interview or the application process, so that we're not having to then come back to them later for more information. So again, probably not easier overall, but I trying to get everything up front so that we're not trying to, play catch up. And there is a compliance period. So if the electronic sources don't say that they're compliant, if we don't have enough information, and we do have to request additional information, there is a compliance period that it'll extend their coverage a little bit until they have enough time to provide this. And I want to say it's another 30 days beyond that. Don't quote me, please. But we are working with that, and understand that some of this will take a while to gather extra information.
Just in the interest of time, because we're running up on 1 o'clock here, I'm gonna turn it back over to Jonna just to run us through the last couple of slides. But I also just wanted to mention to folks that we'll be creating a template for submitting comments if folks are interested in sharing that. I know some of the pieces while some of the pieces are a little bit more flexible than we anticipated, some of them are more restrictive. And so we want to create pathways for sharing organizations and individuals comment on that. So look for that. The comment period ends July 31st. So we'll have that here in the next couple of weeks. Jonna.
Next topic is going to be, we're going to talk about member communication, excuse me, member communication and outreach, including provider engagement. So if you have friends or connections or people that are not on the call today, or not, I think Rhonda, you said before, had to get on her listserv, then please make sure that those who can help with communication. So it is the provider piece that I think Rhonda just put in the chat, right? Bring a provider, but also think about the member communication. To Foster's question and to Sarah's point, it is new. It's new for people. Not everybody opens their mail. Not everybody opens their email. Not everybody. So if you know folks who interact with people who are in this group, make sure that you're inviting them to this meeting, that you're socializing the website, that you're sharing the information within your networks, so that we can do our best to make sure everyone, it's not a surprise, right? Come January 1, that this is not a surprise. With that's our goal. That's the state's goal. And so please do that, especially because we're going to talk all about communication next month. And then the last slide, I'll just give a plug. Questions, requests, comments, people you see that aren't here that need to be added. We do have some lists that we're going to extend the invite to, but you guys are boots on the ground. You know the folks that you interact with in your communities that interact with people that this might affect. And Sarah, any closing comments for you?
No, just, we appreciate y'all's patience as we work through this. It's a lot. We've had the new rules, about 3 weeks now. And but we have been working on this since the rule dropped last year. So we are as prepared as we can be, and I think we're ahead of a lot of states. But again, we need everyone's help to, do this right.